with our very own Sean Franklin to talk more about that. And she also shared some warning signs that you could tell if you or someone you know is experiencing a stroke.
Hey guys, I'm here with Maggie Mccune. She is the Director of Public Outreach for Community Health Works, and she wants to tell us a little bit about strokes and Stroke Awareness Month. So Maggie, let's dive into it. May is National Stroke Awareness Month, so tell me a little bit about that.
Well, basically, we just wanted to help raise awareness for stroke this month and tell you a little bit about it. Stroke is a disease that affects the arteries leading to the brain, and it's actually the #4 leading cause of death in the United States, as well as the leading cause of adult disability. And to give you a little bit of better understanding of what happens when you experience a stroke, basically, the blood vessel that leads to the brain carries nutrients and oxygen, and it's prevented from getting to the brain because of a clot, or maybe that clot has burst. And what happens then is basically you lose some brain cells, and it can cause permanent damage to the body.
That's so tough. I tell you what, good to have a month to learn a little bit more about it. So what are some of the signs that you would have if you were having a stroke or you saw somebody having a stroke?
Sure. The first would probably be numbness or weakness of the face, arm, or leg, or especially on one side of the body. It could also be confusion, trouble speaking, difficulty understanding. You could have trouble seeing out of one or both eyes. And it could be, experiencing some dizziness, having trouble walking, feeling loss of balance or coordination. And when dealing with a stroke, it's really important to act quickly. The sooner you can get that patient to medical treatment, the more likely you are to reduce their risk of death or disability. So if you think you are experiencing any of these signs, or someone you know is, you should call 911 immediately.
That makes a lot of sense. So before people have a stroke, what are some of the things they can do to help lower that risk? Obviously, you would try not to have a stroke if you could prevent it, right?
Right. Well, some things you can prevent and some things you can't. Demographic factors do play a role in this. Your family history of stroke, age, sex, race, all of that plays a role in your likelihood of having a stroke. But there are a few things you can do. And of course, the first is to know your family history. And you can also just manage your cholesterol, control your blood pressure. Another thing you can do is through smoking cessation, stop smoking if you're a smoker. But one of the easiest things you can do really is to just eat a healthy diet and exercise regularly. And with Community Health Works, we do have a couple of resources in that area. The first is, of course, our weekly farmers market here in Macon. It's every Wednesday from 3:30 to 7 p.m. It's called the Mulberry Market, and we have a ton of vendors there who sell fresh, local, seasonal produce, all really healthy for you. The second resource I want to talk about is coming up actually at the end of May. It's a workshop that the Central Georgia Cancer Coalition will be hosting, and the focus of this workshop is to create healthy food that tastes great and develop diet strategies to really strengthen the body's resistance to cancer and other life-altering diseases. It's called the Cancer Fighting Kitchen. It will be held on May 30th here in Macon at the Vineville United Methodist Church. And although it's called the Cancer Fighting Kitchen, of course, many of these same principles apply to other diseases such as strokes. So if anybody's interested in learning more about it, they can go to the Central Georgia Cancer Coalition website, which is www.centralgacancer.org. Or if they want to find out more about the Mulberry Market or any of our other resources around stroke, they can always go to our website, which is www.chwg.org.
All right, well, Maggie, sounds good. So if you want to find out more information, be sure to check out those websites, and we'll talk with you soon. Thanks, Maggie.
Thank you.
Now, your 41 NBC First Alert forecast.